El-Azhary from Ministry of Health Hospital Egypt for her presentation.
Hello. No, good morning.
Good morning, doctor. We can hear you.
Okay. I need the. Okay. I want to share my screen.
Dr. Nadia, could you stop sharing your screen, please?
Oh, okay. One moment, please. Stop. Okay.
Yeah, it worked.
Okay, thank you.
Thank you, doctor. And also, if you don't mind your camera as well. Thank you so much. Dr. Engy, are you ready to present?
Okay.
Okay, great.
Okay. Is it clear to everybody?
Yes, doctor, it's showing.
Okay. Today we are talking about scars. Everybody have a scar. None in the world without a single scar. Scars formed by excess or decreased collagen deposition, not only cosmetic disfigurement, but causes psychological distress and lower self-esteem. Everybody searches for a solution to remove his scar. Presence of a scar affects their quality of life negatively, as it may interfere with movement, causing even disability, like if they are in joints or something like this. Simply a scar can destroy someone's life. Treatment is usually a challenge to us, as there is different poses and shapes of scars that may need a special treatment for each scar. What is the pathogenesis of scarring? We have like three main factors: patient factors, topographic factors, and environmental factors. For patient factors like ethnicity, genetics, age, and hormones, they can affect a scar for every patient. Topographic factors like increased tension of the scar, increased species glands on the area scarred, increased macrophages and extracellular matrix, increasing vasculoelasticity, and non-glabrous skin. About environmental factors like injury, surgical or non-surgical, and inflammation. How the scar is formed? We have three stages, like we know, in healing of any scar. First one, inflammation or coagulation, then tissue formation, and the last is remodeling. In the abnormal scarring, the three stages are abnormal or less than normal, which leads to excess inflammation, excess tissue formation, and poor remodeling, which causing the ugly scarring as the last. We have many causes and types of scars, as we mentioned before, like post-acne scars, surgical, traumatic, burn, even spontaneous scar like keloids, in which shapes like macules, erythematous, atrophic, hypertrophic, and keloid. Post-acne scars, like, I guess 100% all over the world have an acne scar and post-acne scars. They are the commonest. 80–90% they cause be atrophic scars like ice pack or rolling or box scar scars. Hypertrophic and keloid may be affected in 10 to 20% of people. Here are the shapes of the scars: ice pack, rolling, box scar, the last two shades. Surgical scars, we have a rule in surgical scars for the patients, I guess. Surgery always results in scars. Somehow we can minimize the formation if we use some patients and surgeon tips. We can lessen this or minimize the formation of scars. Preoperative planning, wound closure, intraoperative and postoperative, they are of great importance to the patient and to us. Prevention of predicted scar. As we said about surgical scars, they are the mainly scars that can we predict and we can prevent. Here are comparison between patients and surgeons' instructions. Like patient instruction avoid piercing, tattooing, and with people who have positive family history about scarring. Colloidal Nikai about post-acne treatment, we should take care about this. No need for non-emergency or aesthetic surgeries. Post-operative care is very important to avoid colloid formation. Wear proper clothes as surgical bra, silicone sheets over wounds. Avoid wrong movements that may lead to widening sutures. Avoid friction or rubbing wounds. Keep the wound clean. Incisions should be according to tension forces of the skin. We use delicate instruments like more to avoid more skin traumas, especially in black and dark skinned people. Suture edges must be taken with minimal tension forces to avoid overuse and overtension. Avoid wound infection by removing any foreign bodies and giving suitable antibiotics. Use preventive therapeutic modalities like compressive occlusive dressing and interlesional steroids, laser to lessen keloid occurrence, and follow-up of scars, of course. In this paper, there is a details how to manage surgical scars and how to deal with them. Last, traumatic scars, they are inherently heterogeneous. No two injuries, of course, are alike. So every scar has a different shape and individual shape. First step, we can use laser as a conservative and surgical treatment. Laser works on scar texture, friability, thickness, and contractions. In this paper, there is how to treat scars, traumatic, and contractures by using lasers and different types of lasers. Keloid specifically, we will talk about benign, well-demarcated overgrowth of fibrotic tissue, which mainly extend beyond the original boundaries. It's specific for keloid. Scars at ear loops, chin, neck, shoulders, upper trunk, and lower legs, or any place can we use can induce a keloid. They are very, very, very irritating to the patient and pruritic. Incidence from 5 to 16%. Africans, of course, are more than Caucasians than Asians, and affects more people in the second and third decades of life. Precipitating, it may be superficial or deep injuries. No rule for keloid formation. Even spontaneously, it may occur, and after piercing and surgeries. Here, one of my patients had an ear loop keloid after piercing, exaggerated, as we said, pinkish, or maybe too hyperpigmented, sometimes hypopigmented, tender erythematous, and itchy. As we said before about the pathogenesis of scarring, for keloid, everything is on the maximum state. Fibroblasts, keratinocytes, microfibroblasts, fibrocytes, endothelial cells, all of them are increased, especially the collagen of type 3 and type 1, which are disfiguring, collagen not remodeled like in normal scars. How to pre-treatment evaluate, how to evaluate a patient for treatment of scar. We use firstly a clinically site, then scores. We can use different scores for assessing a keloid scar, like Vancouver, Manchester, Patient Observer Scar Assessment, Visual Analog, Stony Brook, Modified Seattle Score. Then recently we use radiological study like ultrasound and Doppler, which may help assess the keloid depth, involvement of underlying structures and others. Doppler, these scales are used recently, as I said. Biopsies are contraindicated in keloids and in scars in general. So we we used ultrasonography and Doppler parameters to assess the activity and the blood flow of keloid. We assess the depth, volume, activity, the vascularity type, arterial or venous, thickness, and systolic velocity of the vessels. This will help us to choose the suitable laser and suitable treatment for the scar of this. Like this in this photo, first, it has no activity at all, عشان no blood vessels. B, low activity, small blood vessels are seen, and last in C, it has a high activity, a lot of blood vessels are seen. Treatment. The main issue, it's a challenge to us. We have many treatment modalities. No one is approved for a scar. We have intralesional corticosteroid, pressure therapy, silicone gel, fillers and Botox, cryotherapy, lasers, 5-fluorouracil seal, TCA and peels, microneedling, surgery, treatments under trials, and fat grafting recently introduced. We can use any of these as a monotherapy or combined. Here in one of my papers, they are about updates in using keloid from the beginning, about pathogenesis and treatment in doses and different trials. For the one who can use. Complications. Any complication would be noticed by patient or physician, like pain, erythema, itching, swelling, infection, hypo or hyperpigmentation, ulceration would be listed. Here are some of my cases. She's a 25 years female, post-acne scars, as you see in the photo above, in form of rolling and box scar. 4 sessions were treated by dermaban or microneedling. And here was the result in the lower portion. Another 25 years female, also post-acne scars. I said it's the most common scar in form of box scar and ice packs. 4 sessions of dermaban and subcision release, it was done also. Here, a male, 23 years old, has a hypertrophic scar of the elbow. That was post-traumatic scar. I did one chemical peeling session using salicylic acid, and he is still on treatment. Here, some of post-acne scars in the forehead, which was a colloidal acne, active lesions. We used one peeling session with salicylic acid 30% together with oral antibiotics. Here we see post-traumatic scar in the forehead and the upper eyelid. We did dermaban 3 sessions and hyaluronic acid injection. As we see in the right portion, it is more superficial around the eyelid, above the eyelid is more cosmetically acceptable and than that on the left. Here, 28 years male, post-surgical, exploration surgical, 2 dermaban sessions, 2 fractional carbon dioxide laser were done. The results on the right is much more shallower, it's much color is better, and he is still on treatment also. Here is a female of 25 years old, post-surgical scar. It was an orthopedic surgical. She had the 3 derma sessions and 2 fractional carbon dioxide laser. Here, another paper about using TCA in treatment of keloid, which is a recent modality, not used much in treatment of keloid combined to laser, fractional laser specifically. Here, another session using TCA, fractional carbon dioxide laser, I'm sorry. We see the keloid on the left is much more wider and higher, pigmented also. On the right, it's more shallower, lighter, and more color to the skin. We use the Vancouver scar scale in assessing these scars. Here, post-thyroidectomy scar, as we see. We have done fractional carbon dioxide followed by intralesional corticosteroids and assessed by Vancouver scar scale. Post-cesarean scar, 27 years old female. We have done fractional carbon dioxide followed by intralesional corticosteroid. Post-traumatic on left knee, we use here fractional carbon dioxide followed by TCA or trichloroacetic acid, 20%. Vancouver scar scale was assessed. It was 11, then became 8. We had some side effects, especially with TCA after laser. On scars on bony prominence, they were the worst. Some had ulceration like this, and some had hyperpigmentation like this. So be cautious about when using TCA combined to laser. Here we had some hemorrhagic ulcerations following TCA. Thank you.